Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. These codes are used to describe comprehensive radiographic surveys of the skeleton. While they sound similar, their use is dependent on age and scope. Let's break down when and why each one is used. 77074. Radiologic Examination, Osseous Survey, Limited. This code is a limited survey used in patients of any age when imaging focuses only on specific symptomatic areas, for example, for metastases evaluation. 77075, Radiologic Examination, Osseous Survey, Complete Axial and Appendicular Skeleton. This code is used in patients 1 year and older when imaging includes both the axial and appendicular skeleton. 77076, Radiologic Examination Osseous Survey, Infant. This code is reserved for infants under 1 year old, per AMA CPT standards. Use this code when a skeletal complete study is done in this age group. Bone surveys are systematic radiologic examinations that include either partial or full imaging of the skeleton. Views will vary per the radiologist protocol. For a limited study, the typical views are tailored to the clinical area, commonly ordered in adult oncology follow-up. Check with the radiology department to confirm imaging protocols of views taken. Standard views for a complete survey include skull AP lateral town, cervical, thoracic, and lumbar spine AP lateral, chest AP lateral, ribs RPO and LPO, pelvis AP and AP upper and lower extremities, bilateral humerus, forearm, hand, femur, tibia, fibula, and feet. Infant survey views include appendicular skeleton, arms, forearms, hands, thighs, legs, feet, axial skeleton, thorax AP and lateral to include thoracic spine and ribs, abdomen, lumbosacral spine and bony pelvis, lumbar spine lateral, cervical spine AP and lateral, and skull frontal and lateral. Report example, age 1 year old, order exam, skeletal survey more than 1 year, header, pediatric skeletal survey history, NAT, non-accidental trauma, comparison, none available. Findings. A pediatric skeletal survey was submitted, including 3 views of the skull, RPO and LPO views of the ribs, AP and lateral views of the trunk, AP view of the cervical spine, and frontal views of the extremities. Normal bone mineralization and no abnormal number of Wormian bones. No acute or healing fracture is detected currently. Apparent thickening of the prevertebral soft tissues, likely pseudo-thickening in the setting of poor neck extension. The cardiomediastinal contours are at the upper limits of normal for age, although not overtly enlarged on the lateral view, likely accentuated by the supine technique. Minimal perihilar and left basilar atelectasis. No appreciable pneumothorax or pleural effusions. Non-obstructive bowel gas pattern. Impression. No acute or healing fracture is detected currently. A follow-up, targeted pediatric skeletal survey would be of benefit in approximately 14 days. Let's look at the patient's age, 1 year old. CPT code selection, views included, skull 3 views, ribs 2 views, trunk 2 views, cervical spine 1 view, extremities AP views. Total views cover the axial and appendicular skeleton. This qualifies for CPT code 7075. Now, let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state: the patient is undergoing a skeletal survey due to concern for physical abuse. The exam is negative for fractures, but suspicion remains. The most appropriate ICD-10 CM code is T76.12XA, Child Physical Abuse Suspected Initial Encounter. According to ICD-10 CM Guidelines Section 9.C20, this code is used when child abuse is clinically suspected, regardless of whether injuries are found. Do not assign Z04.42 in this case, as it is only used when abuse is ruled out and the exam is purely observational. Correct codes for report are 77075, Radiologic Examination Osseous Survey, Complete, and T76.12XA, Child Physical Abuse, Suspected Initial Encounter. Radiology report, age 8 days, order exam, port skeletal survey less than 1 year old. Header, pediatric skeletal survey. History, rule out genetic malformations. Concern for the femoral facial syndrome. Comparison, same-day retroperitoneal ultrasound. Findings, a pediatric skeletal survey was submitted, including 3 views of the skull, RPO and LPO views of the ribs, AP and lateral views of the trunk, AP view of the cervical spine, and frontal views of the extremities. Normal bone mineralization, no acute or healing fracture. Skull, no abnormal number of Wormian bones. A suggestion of mild overlap at the lambdoid suture on the lateral view of the skull, although limited due to overlying support devices, which may be secondary to cranial molding. Subjectively small mandible. Spine, the slightly hypoplastic appearance of the cervical vertebrae on the lateral view, although not well visualized on the frontal view due to overlying chin. 12 paired ribs, 5 non-rib-bearing lumbar-type vertebral bodies. Evaluation of the sacrum is slightly limited by bowel gas on the frontal view and limited by overlying support devices on the lateral view. Pelvis, abnormal appearance of the pelvis, although not well assessed due to overlying material and bowel gas. The ossified pubic bones are poorly visualized, which may be secondary to overlap with the ischial bones. The pubic symphysis also appears widened. Extremities, subjective mild shortening of the bilateral humeri and femurs, focal bony prominence at the medial aspect of the proximal tibial metaphysis bilaterally, which is symmetric. The bilateral fibulae are present. In addition, lucency is noted in the metaphysis of several long bones, which appears symmetric. Other findings. Enteric tube tip overlies the stomach. Apparent thickening of the prevertebral soft tissues, likely pseudo-thickening due to poor neck extension. The cardiothymic silhouette is within normal limits for age. Normal lung volumes, mild streaky bilateral opacities, likely atelectasis. No focal consolidation. No appreciable pneumothorax or large pleural effusions. Mild gaseous distension of the bowel with an overall non-obstructive bowel gas pattern. No convincing pneumatosis, portal venous gas, or free air. Impression. 1. Subjective mild rhizomatic shortening, micrognathia, and possible hypoplastic cervical vertebrae and pelvic abnormalities are incompletely evaluated due to portable study limitations. These findings can be seen in the questioned syndrome, femoral facial syndrome. 2. Apparent symmetric lucent metaphyseal lines in the long bones with some proximal medial tibial irregularities. Additional potential differential considerations include congenital infections, including syphilis. Malignancy, including neuroblastoma and leukemia, is considered less likely, although correlation with labs would be beneficial. Let's look at the patient's age, 8 months old. Let's look at the views: skull, 3 views, ribs, 2 views, trunk, 2 views, cervical spine, AP extremities. Full skeletal survey for an infant. This qualifies for CPT code 77076, osseous survey, infant. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. The radiologist sees subjective findings, however confirms apparent symmetric lucent metaphyseal lines in the long bones with some proximal medial tibial irregularities and suggests other tests to confirm the irregularities seen. Correct codes for this chart for the inpatient chart: 77076, radiologic examination, osseous survey, infant, and Q87.89, other specified congenital malformation syndromes not elsewhere classified. Why bone surveys aren't common in adults. Advanced imaging such as PET, MRI, CT, bone scans is preferred for adults due to better sensitivity and coverage. Bone surveys have limited use in adult oncology unless no better alternative is available. Always confirm that bone survey orders in adults are not meant to be nuclear medicine bone scans or PET-CT combo studies instead. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.